All right, hello everybody. Sorry, it's a little weird. I'm just talking in a small room to a camera, so can't really see you guys. But tonight I'm here to talk to you about the changes in your life that happen between a young woman or a young girl and a young woman. And just to preface, I'm an obstetrician gynecologist, which is basically a doctor that is specific for women. We focus on women's health as young as when you're a child to growing up to a teenager. We can help guide you through pregnancy and help you manage some of the problems that you can have through that, as well as later on in life as well. So just to repeat, this presentation is really to help you through the transition over the next few months or the next few years of your life, so it becomes less of a weird topic, because it's not weird. Everything happens to all of us once we get old enough. All right. So goals for tonight really are just to review some of the physical changes you can expect in your body over the next few months to years, and really just start to encourage you to talk about this time with other people that have been through it, your friends, your family, and other people that you trust. It's a chance for you to ask questions, and if it makes you more comfortable, I can't see or hear any of you, so feel you're completely anonymous. And really, hopefully, you'll remember some of the things that I mentioned tonight. To get started, just wanted to stress, just like everybody looks differently, everybody grows at a different rate, we all have our unique timetables as to when we start puberty, okay? So generally for girls, it starts at around age 8 to age 13, and for boys a little bit later. And the stages in puberty that usually happen are that your breasts start to grow first. That's the first thing. After that, you start to have hair growth in parts of your body that you didn't have before, underneath your armpits, in between your legs. Then you start to get a little bit taller, your hips start to get a little bit wider, and then eventually you'll get your period. And all these things kind of overlap with each other, okay? One doesn't start and then the other one stops. All of these things just kind of overlap. But the first thing usually is breast growth. Boys start a little bit later, and you'll notice that when you're in elementary school, sometimes you guys are, for the most part, the kids are all the same height. And then eventually, once you go into high school and into college, the boys tend to get a little bit taller than you guys, and that's normal. Just wanted to stress that your timeline is your timeline, and everybody is different. So what we'll go over tonight is puberty, or that change from a young girl to a young woman. And the way that we're going to do this is we're going to review a little bit of the anatomy, talk about what the parts of your body are that are specific to being a woman, your period, eventually different things that happen to your body like breast growth, hair changes, body shape, mood swings, and also how to keep yourself neat and tidy, as well as a couple of things for your mom to remind about social media tips and also about safe touch reminders. Now, the chemicals in your body that start puberty start in your brain, and they help transition you to get ready for adulthood. And these chemicals are called hormones, and they're really responsible for all these changes. They're responsible for how you feel and how you look like, and they cause different parts of your body to grow. So you can see already from when you were younger, you look a little bit different, and as you get older, you'll continue to change. So the first thing that we're going to look at is anatomy, okay? So if you look on the outside of your body, okay, we're looking, I don't know if you can see my mouse, maybe not. If you look on the outside of your body, on the corner, on the right corner of the screen is what looks like on the outside, okay? If you've ever seen down there or if you've touched down there, you've noticed that you've got a couple of skin folds. The outside skin folds are all called your labia, and they guard the inside and two openings to the inside of your body. They guard your urethral opening, which is where you pee out of, and they guard your vagina, which is where babies come out of. Towards the bottom of the screen, or I don't know if you can see my mouse, but towards the bottom is where your anus is, or basically where you poop out of, okay? So you have the 3 holes down there, where you pee, where babies come out of, and where you poop, okay? Those two openings, your urethra and your vagina, are guarded by 2 sets of skin folds, which are your labia, and they end up in your clitoris, which is a very sensitive organ. Now, this whole entire external structure on the outside in between your legs, everything that the bottom of your underwear that touches is called your vulva, okay? That's your external genitalia. Now, if we look on the inside of your vagina, there's a little cross section of what the inside of your body looks like. So if you look into your vagina, it's basically a long tube that ends in your cervix, which actually, if you look in at it, which you won't, but if you look at it, it looks like a little donut with a little opening in the middle, and that opens to the inside of your uterus. Your uterus is where babies develop and where your period blood comes from. And if you can see, the uterus is connected to these two long tubes, which basically tube an egg from your ovary into the body of your uterus. And these ovaries, which are attached to the ends of the fallopian tubes, house hundreds of thousands of eggs that you were already born with that you're eventually going to ovulate when you go through your cycles. Your ovaries have also a second function of providing hormones that help fuel your changes in your body. So the first thing really to discuss is the biggest thing that happens during puberty, which is basically your period. And sometimes knowing the anatomy and how things look helps understand what is going on in your body. So the first thing is, what is a period? Okay, a period is blood in a small amount of tissue that is released from the inside lining of your uterus, and it's expelled throughout your body, through the vagina, and then expelled out of your body. So what actually happens is there is an egg that develops in your ovary once you get old enough, and you have this new ability in puberty to become pregnant. Okay, it doesn't mean that you should, but you have the ability to start to get pregnant once you start to hit puberty. This egg travels down the fallopian tube. Once it is ovulated, it lays in the inside lining of your uterus. The inside lining of your uterus starts to get a little bit thick, just to kind of help nourish the possibility of a pregnancy. And if nothing happens, that uterine lining kind of gets pushed out of your body and it gets expelled. And the cycle repeats itself over the next few days, and a new egg starts to be hatched. Okay, and usually this period lasts about 3 to 7 days. Okay. Now, when does your period start? So like I said, usually your breasts start to develop first, but after about 2-ish years or so, your first period might start to show up. This generally happens between the ages 8 to 15, and for the most part, it happens every 21 to 34 days. Okay. There it is, sorry. It happens every 21 to 34 days. And it's helpful to have a period tracker, or at least put down on the calendar when your period is going to happen, because it helps avoid accidents. It helps you become more prepared so that you don't have any accidents when you have your period. It's also good to track if you're having symptoms that are bothering you and if it's related to your period, things like pain, things like acne or mood swings. So there's number of different things that you can use. But like I said, it also helps to track so you can prevent an accident from happening, so you don't have any embarrassing issues at school. What is not normal is if you bleed too much, to the point where you don't feel good, where you feel dizzy, or if you're bleeding much more often than every 21 to 34 days. Definitely let your mother or your doctor know. Or the other issue is if you don't get your period at all. So what do you do when you get your period for the first time? It's going to be weird. I've had a couple of patients say they didn't know what was going on. They thought that they hurt themselves. But tell somebody. Talk to your mother, talk to another grown-up that you trust, and you don't have to go through it alone, because every woman goes through it. Hopefully, if you're at school, the nurse will have supplies that will help you. And if we were here, we would have a mini supply for you, but I'll talk a little bit about the products for feminine hygiene in just a minute. So there are different ways to manage your period, okay? Some girls use pads, and that's the easiest because they're kind of just big stickers that you put on the bottom of your underwear, and it soaks up any of the blood that comes out, okay? The issue is sometimes they're not perfectly shaped, and everybody has a different body shape and size in underwear, so sometimes you can leak through them. Now, there are internal methods that can also help collect your period, okay? There are tampons, which are these in the middle there, and they stay on the inside of your vagina and help collect your period blood, and you discard them and put another one in. Another one is menstrual cups, which is fairly newish. They're little silicone cups that you can put on the inside of your vagina and collect your period blood and discard that and clean them out and then put it in again. And there's also new period underwear, which is relatively new. And they're underwear that can wick up your period blood, and you can just throw them in the laundry. Now, the two that are internal, the tampons and the menstrual cups, are perfectly fine for you to use, but you do have to be comfortable with touching yourself, okay? Because they're placed inside your vagina. The important thing to know is it can be tricky at first to figure out how to put them in, but it's important to know it's not supposed to hurt. If it hurts, it's not put in right, okay? So how does your period feel? So this varies from girl to girl. For the most part, you sometimes feel a little tightening in your stomach or pelvic pain before, just before, or even during your period. Some people say that exercise helps, so yoga, gentle stretching, all that stuff will help. But it's important to know that your period is 100% natural and normal. And if it hurts too much, you have to tell your parent, because there are things that can help, even if it's just like massage or heat packs or even some Tylenol. The other important thing to know is that if your period is starting to interfere with your school, you're starting to miss days because it's too painful, you're starting to skip sports, or is really starting to affect your life, let your mom or dad know, because that might not be normal. Other signs of puberty, like I mentioned, is the first thing is your breasts start to grow. Your breast, you find that your nipples get a little bit darker, sometimes get a little bit bigger and become more 3D, and eventually the breast tissue underneath starts to grow. And it's okay if it's a little asymmetrical, because that's normal. And the next thing that you might also know is hair growth. You'll notice hair underneath the arms, you'll notice hair on your vulva. You'll also notice perspiration, okay? And that also, we'll talk about body odor in a little bit. And then your body shape starts to grow. Your hips get a little bit curvier, you get a little bit taller, and you eventually go through a growth spurt. And the next thing is pay careful attention to hygiene during your teen years. Because puberty is so new and you might have new smells because of all the perspiration and the different hormones that are surging through your body, try to keep yourself from an embarrassing situation. And remember, you can use deodorant if you need to. You're going to sweat in places that you maybe never sweat before and have smells you never smelled before, and that's normal. So just remember to try to wear clean clothes if possible, use deodorant, and take a shower, if possible, daily. All right. Now, the next thing, of course, is skin changes. Acne can start also during puberty as the oil increases on your face and scalp because of your hormones. So really what you do is try to keep your skin clean. Buy a specific facial cleanser. Don't use the same soap that you use for your body for your face, especially if you have acne. And try to apply a facial moisturizer as well as sunscreen. Try not to pick at pimples if possible. Everybody does it, but try not to. And drink plenty of water, because that'll help flush out any toxins that you have in your body. Maintain a healthy diet and sleep. Try to be, hopefully, the least stressed as possible, and that includes also giving time to sleep. It's normal and common to have breakouts in puberty as a teenager, or even in adulthood. And if necessary, you can look at over-the-counter medications that'll help you. So besides the physical changes that you will go through, there's also a lot of hormonal changes that might happen. You might find that there are new groups of friends that you want to talk to, or new interests that might be different. And also you'll undergo a couple of mood swings, okay? These are hormonal changes that make you go from happy to sad, from angry to indifferent, and it's a normal part of life. Talk about it with your parents if it's really bothering you, but what's not normal is if you're thinking about hurting yourself or hurting others, or you're really depressed, then let your parents, let your doctor know, because that is not normal. And then, like I said before, there are definitely things that you can do to help you through puberty. And this is pretty common across the board: exercise and eating right. Try to make sure that you have some physical activity in there, because it'll help decrease your cramping pain and hopefully help with mood swings as well. And the same thing with eating right. If you eat junk food, you're not going to feel great. Give your body what it needs to grow. And the other thing, the important thing, is talk about it. Talk about it with somebody. This is a weird time of your life, and try to make it less weird by talking about it with somebody who's been through it. Your parents, really your mom, your friends, your family, people that you trust. It's not weird because we all go through it. It might sound weird to talk about, but every woman has been through it. And try to remember to support each other, okay? You're going to have an accident one day, and I'm sure that a lot of us have stories where they've had embarrassing stories regarding their period or body odor or something. Try to help others, okay? If you see somebody that's in a bad situation, probably because of their period or have stains, let them know, okay? Because you don't want to be that girl. And the other thing is, try not to tear each other down, because this is a weird time of life where people are going to smell different, people are going to look different, people are going to develop differently. So just be careful what you put out there, okay? Before you talk about it, before you post about it, because social media is such a big part of our lives, be careful what you put out there. And then specifically for the parents, there are a couple of guidelines that you can use, hopefully before your children get too much into social media. Try to make sure that the social media use is balanced with our other important activities: sleep, school, extracurricular activities. It's here to stay, and social media won't ever go away, I don't think. So just try to make sure that it's balanced. Try to be engaged with your child's online life so you can see what they put out there. If possible, try to make sure that you can see everything that they put on the internet, become their friend, or at least follow them and see what they're putting out there. And when you give your child access to social media, try to set boundaries. For example, no phones at the dinner table, or charging stations that are not inside the bedroom so that they're not on the phone all the time before they go to sleep. Talk about with your children why things should be kept private, okay? Don't put things out on social media that, are dirty laundry for the family or embarrassing stories about somebody else. Be sensitive to your child's moods and see if there's anything that is affecting them that could be from social media. It is heavily edited and it's not real life, so some people can use that as a model and have body image concerns because of it. And then lastly, of course, model the behavior you want to see. When you're talking to your children, don't have the one phone in your hand like scrolling through your emails. So if you want them to be off the phone, try to be what you want them to see. And then the last thing, try to take care of yourself. As a teenager, it's hard. You're going to go through a lot of emotional changes, a lot of physical changes, but you are you, and you are unique, and you are valuable. You have to be proud of who you are, even if you're a little bit different from everybody else, because everybody is different. Try to give back to the community, volunteer, share, or support your friends and family. There's a lot of negativity out there, and try to become a positive force in other people's lives as well. You will be put down, unfortunately. Okay, and that's okay, because it happens to everybody, but try to remember to stand up for yourself, and remember what's out there on the internet is not real life. A part of taking care of yourself is also recognizing when something doesn't feel right, okay? If somebody says something, somebody touches you a certain way, if somebody texts you an inappropriate image, tell somebody about it, okay? What your body is yours, and you shouldn't be violated, even if it's in a place that's not a private place. Tell somebody if you feel uncomfortable. hopefully you'll have a safety network that includes your parents or an adult that you trust that you can tell these things to. And if it feels wrong, make it stop or say no and let somebody know. So my last slide here is to just kind of dispel some common myths about puberty and about OBGYNs that I've heard. And then after that, we can open it up for questions. One of the myths that I see is that girls don't feel like they need to see an OBGYN until they're an adult. You don't have to, but we encourage you to see an OBGYN whenever you feel like you have any issues. So some moms bring their daughters just to talk. We don't have to do any exams. We don't have to look at anything. We can just say, hey, we're here. We're a source of information that hopefully you can trust, and we're a little bit more reliable than, what you can find on the internet. We don't have to talk about anything in particular. Just know that we're here if you need to talk to us about something that you're concerned about. Another thing is I've heard that girls don't get as smelly as boys. Girls' body odor isn't as bad. That's not true. Girls can sweat just as much as boys can. And so it's important, like I said before, daily showers, clean clothes, and deodorant. And this one is popular. I hear from a lot of girls that I can't swim on my period. You can do anything you want on your period, but just know that your period doesn't stop. So you can wear a pad if you want, but sometimes they get a little bit cumbersome because they get soaked in water. So a lot of girls tend to use like tampons or menstrual cups, which are perfectly fine. And lastly, there are behaviors that some people say, oh, girls aren't supposed to do that. Girls need to smile more. Girls need to look pretty. There is really no box that girls are supposed to fit in. As long as you respect each other, take care of yourself, there really should be no behavior, no job, no sport that is off limits to what girls can do. All right, okay, so that is my presentation. I can't see anything. So if you have any questions, I would like to open it up and hopefully I can answer some of them for you.
Okay, thanks, Dr. Carrillo. As Dr. Carrillo mentioned, if you have any questions, please type it into the Q&A section on the right-hand side of your panel. And just one question we have, Dr. Carrillo, for the patients that you see at the hospital around this age, in your office around this age, what are some of the common questions they have or common issues that you usually discuss with them?
Well, usually we see girls who have starting to have issues with their periods. So like I said before, sometimes they have issues bleeding, or they have really bad mood swings, or they have really bad pain that's keeping them from sports or keeping them from school. And so we talk about different ways to manage that. And that can be hormonal ways, or they can just be pain control ways, just to help guide them through that time.
Okay, thank you. We do have a question. This is for one of the girls. And the question is, what if your blood leaks out, or you forgot a tampon, pad, and all the other things with you? What if someone sees you?
I hate it when that happens. It happens to all. It doesn't only happen in the beginning of puberty. It happens when you're like 35 years old. So it happens, unfortunately. So hopefully you'll be near someplace or someone that has a supply of pads. So ask your friends at school, ask the nurse, ask to be excused, put a jacket around your waist, and hopefully the nurse should have something to help protect you. But accidents happen. So I encourage you, even if you don't have your period, just to put a couple of pads, a couple of tampons in your locker, and sometimes even just a change of shorts or clothes to save you from that situation.
Thank you. And then another question is, how many times should girls between 9 to 12 years old see an OBGYN, and for what reason?
So 9 to 12, really, it's up to you. If you're having issues, or if there's something that you're confused about with your body that you're not sure if is normal or not, you're more than welcome to come to us. Like I said, we don't have to do any exams unless you want us to. If you want us to look at only a certain body part, that's perfectly fine too. You don't have to see us that often unless you're having an issue that we need to follow. For some moms, they just bring their daughters just so that we can talk about things and so that you're not so weirded out when you see an OBGYN. Because sometimes we're associated, oh, we do pelvic exams, oh, we'll do breast exams, oh, we'll do pap smears. We don't have to do any of that stuff. We can just talk, and we can just talk about your problems and let you know if we think that that's normal or if it's something that we need to look into.
Okay, wonderful. And then another question from one of the girls, why do our hips get big?
Oh, well, it just has to do with childbearing. That's the way that the women's body shapes are. Your hips get a little bit bigger. I think it's probably something evolutionary with childbearing, but that's just the way that our bodies grow.
All right, thank you. Another question. I had bad cramps when I was younger, and I had to take medication for them. Is there a chance that my daughter will have them as well? And what kinds of treatments and medications are used for cramps today?
There's a good possibility that your daughter may also have cramps as well. Hopefully not, but there are over-the-counter medications that you can take. You can use Tylenol or Motrin. If possible, Motrin's a little bit more effective than Tylenol for bad cramps. And if your cramps are really, really bad, sometimes I can tell patients that if you know when you're going to get the cramps, when you're going to have your periods, you can actually take that medication before you know you're going to have cramps that day and hopefully prevent them from happening. If that doesn't help, then you can go to your doctor and you can talk about pills that might help with regulating your periods and regulating your cramps.
Thank you. And another question, can puberty and hormones cause headaches?
Oh yeah, 100%. Maybe not puberty, but specifically the hormones. So some women have migraines that are associated only when they have their period. So that's why it's important to also track your periods, because when you track your periods, you can also track when you get these headaches. So for some women, they get headaches only in the beginning stage of their period, and they'll find that every month it's the same pattern. I only get a headache when I start my period, and it's really bothering me. So like I said before, there's medication out there that can help control your hormones and help control your headaches if they are related to your periods.
Okay, wonderful. And then another question for you, around what age should women get their first pap smear?
So the guidelines have changed over the past few years, but the standard now is that women generally get their first pap smear at age 21. So in the past, it was when they started teenagers, when they became active, but now it's 21, whether or not you're active or not, and sexually active or not previously, it's at the age of 21.
Okay, thank you. Another question came in. Sometimes my daughter can get irritable before her period. What can we do about that?
Hopefully it's not affecting her school life or her family life too much. But in terms of irritability, of course, you can kind of just try to, help them at home in terms of, exercise, yoga, kind of getting around their moods. But if they're starting to affect their school life, their family life, then we would talk to you about different pills, which are basically birth control pills. I don't like that they're called birth control pills because they're really more for hormonal regulation. That's only one of the benefits of them. But to help regulate your hormones, there are pills out there that'll even out your mood a little bit more, so that you don't go through rapid mood swings if it's really starting to affect you.
Okay. And then another question is, how do you know when a girl will get her first period?
So how do we know when so with time, you will get your first period. Usually, like I mentioned, your breast starts to develop, and then you grow a little more. You still have a little bit of hair growth in areas you didn't have hair growth before. There's really no warning sign when your period will start. Besides that, you just see blood down below. Can't really predict when you're going to have it. You can look into your family history. You can see like, oh, is everybody in my family get it around a certain age? And you can follow that. But besides when you start puberty, there's really no marker like what age or predictor or blood test that'll tell you when you're going to get your period.
What is considered a normal growth spurt for girls?
So there are actually different calculators for this. It all depends on what your parents' height are. So it's a little bit difficult, but all I can say is it depends on what your parents' heights are. Obviously, if both your parents are 5'3" and you're already like 5 foot, you're not going to have a huge growth spurt. But if you feel like you're a lot shorter or a lot taller than your parents or anybody in your family, then you let your doctor know or pediatrician know, because that could mean that it's something else.
Okay, perfect. What is the best way to remove underarm or leg hair? Shave, nair, wax, if it's making my daughter uncomfortable, the hair.
Right. So there's different ways to remove hair. Shaving really just kind of cuts it off. The issue with that is that sometimes women get ingrown hairs with shaving. And the hair grows a little bit thicker just because you're cutting it off at the middle where it's the thickest, and that's where it'll grow. So it'll look like a little bit darker if you shave. Nair does the same thing, but it kind of dissolves the hair. It's the easiest though, but it does have a smell. And plucking is a little bit painful, but it does get the hair out at the root. The same thing with waxing. So it's really whatever you're most comfortable with. What lasts the longest, obviously, is waxing, because as you remove the entire hair follicle, it takes a while for the hair follicle to grow back. But with shaving, you just have to be consistent with it and just be careful because it is a sharp object. There's really no best way. The best way is whatever works the best for you. Just be careful of ingrown hairs and try to exfoliate, especially if you shave or wax, because that can pose problems as well.
Okay. And then what would you recommend for them to use to exfoliate?
So there are a lot of dry brushes out there. I'm sure you can look on Amazon for like exfoliating gloves and dry brushes. Some estheticians recommend dry brushing before you get into the shower. So you just kind of brush the areas that you may have ingrown hairs in to help release some of that excess skin and make it easier for the hair to poke through. Then as you shower, you can also use exfoliating gloves under your arms or in between your legs to help exfoliate as well.
Okay. And then there's a question about, can you share some information about the HPV vaccine and when should they get it?
So the HPV vaccine has changed for the better over the past few years. It was introduced maybe in the early 2000s. And so basically what it is HPV is a virus that is transmitted sexually, which can cause abnormal pap smears and possibly cervical cancer later on in the future. So if you remember, the cervix is that little donut opening to the inside of your uterus. So what the vaccine does is that it protects you against a certain strains of HPV that can cause cervical cancer, abnormal pap smears, as well as genital warts. Okay, so once you get this vaccine, you'll basically be immune to 90% or 80 to 90% of cervical cancers and 80 to 90% of genital warts. It's a series of three shots, sorry. From the first one is that it's 2 months away, and then after that it's another 4 months. So you'll get one shot, 2 months later you get another shot, and then 4 months later you get another shot. And it's recommended because it'll help prevent you from getting cervical cancer and genital warts later on in life.
Okay, thank you, Dr. Carrillo. Another question we have, it says, can you have a baby at a young age like 10 or 12?
So, like I said, puberty gives you the ability to be pregnant. And if your ability is there, then it's potentially possible that you can get pregnant at that young if you already have your period. Unfortunately, it does happen in some parts of the world. And remember, just because you have your period doesn't mean that you should get pregnant. You have the ability to, but of course, you know, you have to wait for the right time in your life. But yes, you do have the ability to become pregnant when you get your period. And if you're that young, then it's possible.
Okay. And another question is, how do hormones affect the skin like acne, and what could be done to have clearer skin?
So unfortunately, hormones are responsible for a lot of the oil, or can be responsible for some of the oil production in your skin, which can cause acne. Really, what to do is try to wash with a facial cleanser, lots of water, try to de-stress and sleep as much as possible, change your pillows or bed sheets pretty often. And if you need to, you can use over-the-counter acne medication or even see a dermatologist. Now, some women also end up using pills that'll help control their hormones, which are birth control pills, to help quiet down their hormones so that their acne is not as bad. So sometimes your dermatologist can prescribe it, or you can ask your OBGYN if you're concerned about acne breakouts during your period or acne in general, to see if that will help.
And another question here is, first is, what is ingrown hair? And then the other thing is, what can you wax with that's safe? What can you use to wax?
So what an ingrown hair is, so a hair follicle, I don't know, I don't have any, I can use my hands. So a hair follicle kind of comes out of your skin, okay? But that's the way that it grows. That's how all of our hair grows. It comes out of the top layer of our skin, and it pokes through it, it comes through. But what an ingrown hair is that it can't poke through that top layer of skin, so it curls on the inside of your skin and causes a bump. It can get infected and kind of can become almost like a pimple until that hair is kind of plucked out. So especially for women who have thicker hair, it can become a problem because it can be painful when you get ingrown hair. So what was the second half of that question, Michelle?
What's the best, safest thing to use?
Oh, wax.
As a wax.
Yeah. You have to be careful with wax. There are multiple different types of waxes out there. There's sugar wax, there's honey wax, there's wax that you have to heat up. There's wax that's already on a strip for you. Try not to burn. They're all pretty, for the most part, pretty safe. I think everything that you can get over the counter is pretty safe. You have to be careful of what you're allergic to, okay? And you have to ask somebody to help you because you might not do it right the first time. The probably easiest ones out there is the wax that's already on the plastic, like on a plastic film. You can find them on like CVS or a drugstore. So it's wax you don't have to heat up. It's a wax that's already on the strip, and you can try to see if it helps removing, but you have to make sure that you follow the directions very carefully. So heated wax can pose a problem because sometimes you can burn yourself. But if you have any questions, I would ask your mom, even if you wanted to ask an esthetician or somebody who removes body wax. But be careful if you're going to use any of the stuff at home, because you have to be careful of what you're allergic to. You have to be careful of what the temperature is, and you try to make sure that you're doing it right. And it's a lot of time, it's a trial and error as well.
Thank you. Another question here is, with the HPV vaccine, what age is the recommended age to get it, and do you need to have gotten your period for you to get it?
That's a good question. There actually is, the recommended age is probably between the ages of 9 plus. Okay, I say plus because you don't have to, you can get it at any point in your life, actually. Hopefully you get it before you start to become sexually active, because that's when it'll work the best. Before you get exposed to some of the viruses, if you're already immune to them, you don't have to worry about it. But even if you've already had a partner in your life, it's important to get the HPV vaccine because it might cover the strains that you've not been exposed to. So you can get it as old as you want to, but I think the current insurance regulations are that they won't cover it if you're older than the age of 26. So preferably you'll get it when you're a young girl. And even if you have any sons, we encourage them to get it as well so that they don't become spreaders of HPV virus. And hopefully, before you start to become active, it'll be effective for you.
Perfect. And then another question here says, do these hormonal changes impact the girl's academic performance?
Usually not. I don't think there has been a correlation with, academic performance and hormone changes. The only thing that I can really think of is obviously if they're missing school because they're having too many issues with their periods, too much pain, or if they're having drastic mood swings. Be careful in the teenage years because you also have to watch out for any depression. And of course, that can impact how well your kids are doing in school. So basically, hormones don't really affect academic life, but you have to be careful of the changes, the emotional changes that go through, you go through with your period. Oh, sorry, with puberty, because that might also affect how you do in school.
All right. Well, thank you so much, Dr. Carrillo.